Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, chiropractic, and medical related information. I'm Dr. Adam Rodnick, chiropractor out of Commerce Township, and I'll be your host today.
And I'm your co-host, Dr. Ruvayn Rubinstein out of Troy, Michigan.
And we're here with our special guest, Dr. Grace Patterson out of Southfield.
Thank you. I'm glad to be here.
Welcome to the show. So I want to start off by talking about how you got into the profession and then kind of your transition from med school to ER and urgent care and to the kind of practice you have now, which is home care and holistic practice.
Wow, that was a mouthful, but the transition is just like you said. When I started in the field, of course, gung-ho, I want to save the world, I want to do this, and I want to do that, I want to see people well. But our training, first year medical school, you learn how the body works. Second year of medical school, you learn how it doesn't work with the pharmacology, with maybe a week or two of nutrition, or matter of fact, only 2 weeks to be honest, of nutrition. Then clinical rotations, and then they push you out there and 15-minute visits, just write a script. And I'm like, hey, this doesn't sound right. So I started my fourth year, I took an alternative medicine elective, and it struck a chord with me. And it was just always in the back of my head, the traditional medicine model. I'm like, hey, we're missing something. So I started going out reading and doing different classes and researching on my own, and come across the nutritional piece. If they say food causes harm, so food should be able to do better, right? Make people feel better. So I started reading about nutrition and vitamin supplementing, and then I came across some information for every pharmaceutical that a person is on is depleting them of something nutrient-wise. So when I start implementing that in my practice, I've started seeing wellness in my patients. But as you know, the traditional medicine model, if you're not feeling well, you come into my office, so I'm getting paid. But but at the same time, I want to see people well. So that's how I made that transition.
You want people to stay well rather than
Absolutely.
Just see you for sick visits. They want to do things on their own, be proactive about their health.
Absolutely.
So was there a big gap between when you took that holistic class in school, the alternative medicine class, to then now starting your holistic practice? There was a big span between there where you did your residency and your fellowship and emergency room and urgent care and everything, right?
Right, a whole big gap. Okay, you know how they say you have a journey, so that was my journey. When I first, matter of fact, there was a big gap in between me practicing as well, because I had some family issues with my mom being sick, my daughter being ill, and that was also at the beginning of my research of trying to figure out how to keep people well. So
personal testimony to everything,
absolutely, absolutely. So then once I started working for other people, I started doing home visits as a side gig, if you want to call it that. I always wanted to go into patients' homes because you can see the environment. And versus when they come into your office and you're like, Mr. So-and-so, why isn't your sugar being controlled? I don't know, I'm taking my medicine, I'm doing. But when you go into the home, I can see the cookies, the bonbons.
Oreos all over the place.
Yes. I've seen
empty
patients.
beer cans everywhere.
Yes. Or I don't know why my legs are swollen, and I could see the yellow Mellow bottle right next to the lounge, the lazy boy. And
the indentation of their legs in the lazy boy.
Absolutely. I can see all of that, and then I can talk to them about it. And when you talk to them about it and you show that you're really sincere and care for them, you'll see a change the next time you come. Either they're hiding it or really when you do the lab test and do your exam, you can see a difference. I have one patient, when I first came to see him, he had these big bunk cakes. The next time I came, it was smaller. He said, see, Dr. Patterson, I'm trying.
So he's working on it.
Right, he's working on it. So, but as I said, that was always a side gig. I've done, I've covered nursing homes. For one practice, that's all I did. I did nursing homes. And then I started doing urgent care, and I was pulling those 14-hour shifts.
You want to get away from that a little bit.
Yes.
Family time.
Absolutely. And then, but I was still doing home care on the side, and it got to the point where I said to myself, the time that I'm putting in someone else's vision and dream, I can put it in my own. And then there was a fear factor, urgent care working for someone else, there's that steady check come in.
Right.
So when you're an entrepreneur, it's like, how they say you eat what you kill, kind of, so to speak. So I finally stepped out And then so based upon my studies and research and working with people, because what I would do for like people that have a diagnosis of diabetes, I'll say you have cinnamon in your cabinet, start using some cinnamon. Or I'll write down on their script pad, you know, go to the food store, get you some chromium. And when I would
Chromium and vanadium, there's a lot of things people
Absolutely.
can do that they wouldn't think of, and it's not really in the traditional medical model that they can work with each other. And that's one thing that, you know, we try to do in our practice is, you know, we're a little more holistic, but I'm happy to work with the traditional allopathic model as well for the benefit of the patient. We don't have to butt heads. We don't have to, you know, one or the other. They can kind of transition and work on becoming more proactive while still maintaining their allopathic standards as well.
The mindset.
Yeah.
Because that's what it's all about, the allopathic mindset. That's what people think is normal. So how was it for you to get your patients to come in basically with an allopathic model and you having to transition them to the holistic model? Because they're coming to an MD, they think they're going to be in that same medical path of here's 18 scripts, go fill these bottles and take them. And then you say, hey, wait a second, we're going to try a different approach. So how was that for you transitioning the patients?
It wasn't hard at all because when I first come in after our set of vitals, where are your bottles? You know what I mean? So they pull them, you know, they pull them all out and I set
It's
there.
easier in the house. You
Yes,
see
I'm in
it
the
right
house.
there.
So we go through every bottle and then, you know, there's so many apps now with our phones. So I put all that stuff in. If there's any interactions or things that are not matching or any, I tell them, hey, look, this is not, we're going to stop this.
How often do you see drug interactions that weren't caught by, let's say, the pharmacy or anywhere else too? Because a lot of patients may go do multiple different doctors to get multiple different scripts, multiple different pharmacies to fill them.
Absolutely.
The pharmacist can't catch that. The
Nope.
doctors can't catch that. Do you see that commonly?
All the time. And then when we go through that regimen, believe it or not, 85% of our patients are taking some type of supplement, whether or not as a doctor we want to admit it or not. So that transition wasn't as hard as you might think because they're taking them anyway. So we might have that a conversation about what might be the best supplement for them. And based upon their medications, certain medications deplete certain nutrients. So when I say, hey, you're on this medication, you possibly depleted in this, let's narrow in on getting you on those certain supplements, or I'll just put most of my seniors on some type of multivitamin.
And that's awesome.
I love how you say that you know, the patients are doing this anyway, so why not talk to them about it? And that's one thing I like to talk with a lot of the primary cares in my area that share our patients is the same thing. You know, PCP's patients are seeing chiropractors anyway. So there's no reason why we shouldn't be able to communicate, work with them, let them know what we're doing. They can let us know what they're doing, and again, for the betterment of the patient. I mean, they're going to be doing it anyway. So, you know, there's a traditional impression for most people that chiropractors and PCPs can't work together, don't communicate, and you know, I don't like to buy into that at all. I'm happy to communicate with PCPs, with really any kind of specialist. And the thing is, like you said, these patients are going to be seeing their PCP and they're going to be going to chiropractors anyway. They're going to be taking supplements anyway. So why not find out what supplements they're taking and maximize the benefit they're gaining from what they're already trying to do on their own anyway?
Yeah, add wellness to it. They're so ingrained, it's ingrained into them to think that there's only one way.
Right.
And that's what it comes down to. Since they were little kids, they think that, you know, what their doctor tells them has got to be right.
Right.
So let them keep that. But let's add some extra healthier things to that repertoire and let's get them well, because that's the goal.
Right.
Is to get your patients well.
And what I like about the way you say that you're practicing as well is that you can meet them wherever their goals are. Someone comes in, they say, I need this, I really, you know, there's a prescription for that, and you can say, yes, there's something for it, and you can write them, you know, a pharmaceutical product, a prescription for it. Or if they come into you and say, hey, I'm looking to get off my medication eventually, how can I do that? You can help them nutritionally, you can help them that way as well, but you kind of meet them where their goals are. Is that?
Yeah, that's true. But you believe there's a lot of myths out there that people think once you have this diagnosis or on this medication, you're on it for life.
Yep.
And it's a mindset, like you said earlier. And if a person thinks that,
They'll keep their high blood pressure high.
Absolutely. So it's also an education piece that's very, very important. And that's another reason why I like going into their home, because the guard is down.
Yeah.
Because anytime they come to you, to your office,
White coat syndrome.
absolutely. And it's not only increase in blood pressure, it's also, I don't know what to say, or dang, I just left the office. I wish I could have asked that question.
Should have told her about that.
So when I'm in the home with them, before I leave, I say, I know we talked about a lot. Is there anything else that you can think of, or is anything else that you want to talk about? And also what I have them to do, I have them to repeat back to me the things that we talked about and what their goals are. And once you do that, you will actually see a change and a progression and them taking responsibility in their health journey.
So how long does a typical home visit usually take for patients?
Oh, wow. My first one can be anywhere from an hour to 75 minutes for the
Okay.
very first one. Because, like, again, we're going through those 20 bottles of medication. I'm actually doing a thorough history background. If they've just had a hospital discharge, I'm going through those papers, seeing who their doctors are. If they have follow-up visits, I'm making sure, hey, you have an appointment to see this specialist. Have you made that appointment yet? I'm also work with agencies with the home care to make sure if they need physical therapy or whatever else that they may need, getting that stuff in place too to make sure they have the care that they need right after the hospital discharge.
You were saying that before you go to them, they've already had their vitals already taken, their blood work already done. So you go to their house and all that stuff is already done. So you see all the results of that?
Oh, sometimes
If
it
they're
is.
discharged from a hospital.
If you're discharged from a hospital, yes, and we're the follow-up. But if it's like my first visit and they haven't seen a doctor in a while, we're bringing the office to them.
Oh, wow.
So I'll ask them, when is the last time you had lab work? Or this is the terminology I use. Someone got blood out of your arm, you know. And so they'll say, it's been a while. I'm drawing blood in the home.
So you're doing all of it. Is it just you who goes into them, or you bring a nurse with you?
I have a nurse or a medical assistant that comes in with me. I also ask them if they had any cardiac workup. We could also set that up in the home as well. We can do echoes, EKGs in the home. All my diabetics, standard of care, we do Dopplers, arterial and venous.
Oh, awesome.
So you take any blood, urine, EKG, pretty much anything you usually would get at a PCP type office.
Yes.
No X-ray or radiology though, correct?
X-ray can go into the home, believe it or not.
So you have a portable everything. So you're like you're bringing it back to the old school way. The
Yeah,
doctor
100
came in
years
with
ago,
the
that's-
bag and
people would make the rounds and your
Yeah.
doctor comes in to see you. What
Believe
you
it or
said?
not, I do sometimes get a little eggplant and some squash from people's gardens and
Wow.
green tomatoes the last visit that I had. Yeah.
So with most insurances, what is the kind of the criteria for someone to be able to have a home visit?
Okay, they have this term called homebound criteria. And a lot of people think that they have to be bedbound or can't get out of the bed to have a visiting physician, and that's not necessarily the case. It's a taxing effort, and most seniors, it's taxing for them to get up, downstairs, into a car. So anything that is taxing for that patient and for their family members to get them out will meet a homebound criteria. Fall risk, cognitive abilities. A lot of them have dementia and they need assistance to get out, or they might be early dementia and I just don't want to get up and get out because it's hard for them to remember how to get to the doctor.
Can children be eligible for home visits too? Let's say they have cerebral palsy or
Yes.
neurodegenerative disorders, anything like that?
Absolutely. That does meet the homebound criteria of a taxing effort to get them up and out.
Okay.
and all insurances cover this.
It's all depend. Now, I can't say all,
Yeah.
but majority of them do. And it's, they need to call. And what we do, we verify insurance. But you have to know what your particular.
Asking for.
Yeah, absolutely.
Interesting. So what percentage of your time is spent in the homes compared to in your office for the holistic practice?
Okay, for the holistic practice, right now I'm building that. So we're like 1.5 day in doing that. When people come in for that, it's mostly more like what we call concierge medicine. What we're doing, we're rolling that out to not to take a place of your primary care doctor, because we can still coach you. We call that health coaching, because the things and the testing that we provide, traditional medicine does not offer. So like our micronutrient testing, which is our vitamins. So you may get a vitamin D now from your doctor, or maybe a B12, but we're doing A, D, E, and K. We're doing antioxidants, which is the glutathiones. We're also doing the macronutrients and all of that. And we're not taught that in medical school. We're not trained to do those.
So tell us a little more about the micronutrient testing. Is it through blood work?
It's through blood work, and the beauty of the test is it'll tell you, hey, this is what your deficiency is, and then it'll give you a report. Like, say, I'm going to use vitamin B12. They say, this is vitamin B12, this is how it works in the body. And if you're deficient, these are the signs and symptoms that you're experiencing. And most often when they're reading it and they're deficient, like, oh yeah, that's exactly what I'm experiencing. And then to the milligram dose, the report will tell you what you need to supplement, and then they'll tell you what foods to target. So not only are we telling them to take supplements, we're also telling them how to change their eating habits.
Because there's a lot of diseases, like MS has a lot of the same signs as B12 deficiency.
Right.
So there's a lot of diseases that people may think they have because they've gone online and they've gone on WebMD and they've diagnosed themselves with everything in the world.
Right.
And it can be as simple as just changing their diet or getting on a supplement and going that route. I mean, once those people get on WebMD, like you said earlier, in their head, now they're scared and now things start going wrong. But go get tested.
Right, absolutely.
That's what it comes down to. Do you also do allergy tests?
No, I don't do any allergy testing, but I have noticed, believe it or not, once they change and supplement and get their levels where they need to be, most allergies dissipate.
Oh, I believe that.
Yeah, so, but I don't actually do any allergy
And
testing.
let our audience know. So would you say that, most traditional blood panels or the blood work you would get at a PCP office wouldn't test for all the stuff you're talking about
Oh,
here, right?
no. The routine test when you go to your doctor's office is what we call your sodium, your potassium, your chloride, which we call our lights, and your kidney
is your
function.
CBC,
Yeah, CBC, which is your a blood count to check to see if you're anemic or not. Like I said, now they might do a vitamin D because there's so many studies out there that say everyone in Michigan is vitamin D deficient, by the way.
Yep.
And every senior that I've done a vitamin D test on, if they're not on it, they're deficient. And I put them on that, by the way. So, yeah, you're right. We're not trained to do that, and most insurance companies will not cover that. So for my Medicare patients, for the micronutrient test, and it's a $1,500 test, but this company that I work with, they got that price down for $88 for my seniors.
$88,
Yeah,
wow.
so...
Some insurances do cover?
Some insurance do cover. Make sure you have the right diagnosis, and you guys know what I'm talking about.
Yeah.
To make
I'm going to
sure-
come in. I'll give you my insurance card. See if we...
right. So, but the beauty of that, my seniors, I can tell them what they need to target, and they're happy about it. And I work with my seniors. They may not even have the $88, but I'll go ahead and get the test done for them. And next time I come, baby, I have a money order for you for $20.
Yeah.
So I'll work with them because
Sure,
I
sure.
want them to be well. I really do.
So anyone could do this test though, because like I can come in for $88 and get this test done.
That's for the seniors.
What about?
Come on, Doc.
I just want to know how much.
Pull out
So
the
if someone
wallet,
doesn't
Doc.
have insurance, what it cost out of pocket?
We're going to talk about insurances for a moment right here, and I don't want to be a negative Nancy, but when I had tried to do it for regular routine insurance companies and tried to put it through, being as non-traditional, they got a big denial, and then the person was wind up with the bill.
Yeah.
So I don't want my patients to wind up with a bill, but we have worked something out with the lab company, upfront costs. If you just go ahead and pay that, you don't have to wind up with a $1,500 bill.
Okay. Awesome.
Cool.
This is something that everybody should get done.
Yeah,
Right.
you're right.
We
Not
got
just the
we got that
seniors.
cost down to about a third for
And
people
so
that are paying out
some
of pocket.
people can switch to you as their primary care,
If
or
they
they
want.
can maintain their relationship with their primary care and just see
Absolutely.
you for the holistic approach, right?
Yes.
Because
yes.
you can, if they just want to see you as a regular primary care, they could come to your office,
Mm-hmm.
or if they're homebound enough, you could go see them and do regular testing and
Mm-hmm.
write prescriptions and everything else that their average primary care could
Right.
do as well, right?
The concierge piece, where you're paying out of pocket or pay as you go for the services, I could still come to your home regardless if your insurance has that benefit or not, because you're paying me as your life coach, basically, your health coach, I call it. So that's what the concierge
So
piece
you do
is.
house calls for, let's say, families that want to have
Absolutely.
holistic care.
Absolutely, we can.
and blood work
and
or
like I
whatnot.
said, I love the home
Yeah.
environment because, like I said, the guard is down, and we can just have. It's like we're talking here.
Yep.
You get so much more information than being a block of time in office, if that makes sense.
A practice with no walls, essentially.
Yeah.
You know, you can do
Absolutely.
it, and sometimes you can use insurance, sometimes not, but practice with no walls.
And traditional medicine is growing now. I mean, you see it everywhere. It's like, people call it a fad. I like to call it hopefully something that it turns into a real thing, because people are starting to eat well. At least the ones that I'm all friends with online and stuff. But they're eating well. They're exercising more. So you've noticed the change in people's not completely just believing everything their doctor is. They're actually trying to go outside that box a little bit.
Yes, well, I have, how can I say this? I work in inner city, and then I have high-end clients. So I have the whole spectrum. And so for the people that are like in the inner city, they have food deserts. So like, they don't have a Whole Food or a Plum Market or where they can get fresh fruits and vegetables. In one area, they have what they call the veggie truck. The truck actually comes with fresh produce onto the site for them to get it. But yes, I'm seeing more of that now than the urban gardens. When I said earlier, sometimes I get fresh fruits and vegetables. The one lady, she actually lives next door to an urban garden. So after I finished my visit, she took me over there and said, "Hey, let's pick this for you," you know. And
that's nice.
that's what I'm saying. So you see, the people are becoming more aware that this is serious. You know, fast food is killing you. So it's like, okay, if I can't get the fast food, but there's not a market
Yeah,
that I can
there's no other options.
Absolutely. So yeah, and then on the higher end, the people that can afford it, definitely, they're like, I want to live longer, I want to live stronger, and I want to live better.
I mean, that's what we deal with our patients. Coming from chiropractic is definitely more of a traditional medicine than the allopathic model. We're definitely more of a holistic approach, and most of our patients, it's sad to say, they use chiropractic as a last resort. They've already tried all the allopathic models, and now they're trying chiropractic, and now they're trying the nutrition, and now they've given up basically, and now they're like, oh, I've heard of this one thing, let's try it out. And our goal is to get patients well. I wish it was flipped around, that they would try a more traditional approach first, and if that doesn't work, okay, let's fill you with all these lotions and potions and pills
for
and
us,
stuff.
people come in with just the impression that chiropractor is just for a specific ache or pain
Symptom.
only. But our goal is to be holistic as well, to keep their spine and nervous system functioning as well as possible. I tell people to think of us like a dentist for the spine. You go to a dentist to keep your teeth healthy, but we want to keep the spine and specifically the nervous system healthy. And so we really like working with physicians and primary care doctors like yourself that are more receptive to keeping the body well and healthy rather than just masking symptoms or feeling good instantly. You know, a lot of people come in to see us and their goal is right away, we just want to feel better right away.
Right.
Well, the goal with our chiropractic care is not just to feel better instantly, it's to heal better instantly.
Right.
For the body to function at optimal. As we see that the brain sits right at the top here, the brain stem here, the spinal cord runs right through the canal here, and each individual nerve comes down to control and regulate everything. So we work with a multitude of different conditions, not to cure each condition, but just to keep the body functioning and healing at an optimum genetic potential, because each one of these nerves controls different parts of the body.
Right.
It's not just the spine is for back pain, the spine is to hold you up. The spine literally is the housing for the communication system to every single thing in the body.
Yeah, and most people come in, like Dr. Rodnick said, they're looking for that, I want that fixed, because that's the allopathic way. I'm in pain, let's take something and completely cover it up.
Right.
But like you said, let's talk about teeth. If you went to an orthodontist with crooked teeth and you told him to give you a beautiful straight smile in a day, it's not going to happen.
Right.
We're restructuring the bones of your spine to put them in the optimal shape and position so that your nervous system can flow freely. It takes time. Can you get relief right away? Absolutely, but our goal is to actually restructure the foundation of your body. So it's going to take some time, and you may be a little sore after it because there's little intricate muscles attached, but that's our goal. Our goal is obviously to get the patient feeling well, but the goal is to make sure that their body stays well for a long period of time.
Absolutely. And the example that I use for my patients so they can get an understanding, my perspective on their wellness, I tell them it's like being a boat with a hole in it, and the water is just gushing in, and they have this pot and they're just pouring out the water. The pharmaceuticals is the pot.
Yep.
It's just
I like that.
treating the symptoms. We need to patch the hole. So that was, and I make honest gesture, we're going to figure out what that hole is and patch
Yep.
it. And then so if we have to use some pharmaceuticals, if we have to use some supplements, but once we use those, at least the hole is patched.
Yep.
But
Maybe
that's
something just lifestyle change. Maybe
absolutely,
you're going to find the hole, though. when we get to the
absolutely, you have
bottom.
to find what the hole is, but traditional medicine doesn't teach us that.
Yep, you got to find the cause.
You have to find the cause, and unfortunately, in my holistic part of my practice, I do see the people after they've seen several specialists, and they have no idea what is going on. So when we do those non-traditional tests, then that's when we are able to get them on their way to feeling better.
And that's what it comes down to. Like I said, they've used this as their last resort. I've had patients, they said, I've had all these weird symptoms. I've gone to the doctor and they tell me there's nothing wrong with me. I go, well, let's see what your spine looks like. And I'll x-ray them and I'll show them right there. A normal spine looks like this. That's for optimal potential. And their spine looks like that.
Wow.
I go, well, there you go. This is what's something wrong with you. Your spine is pinching off your nervous system. Your nervous system's not going to function properly if your spine's in that position. And it was the first time, and they thanked me because it's the first time someone's actually told them there is something wrong.
Right.
It's not just in my head. Because a lot of people, they take all the tests and the doctors, they come back as unremarkable tests. So they're like, wait a second, now they start questioning, is it in their head? But I can show them with the x-rays, hey, here's something wrong, this is how I'm going to fix it, and there's hope. And that's what people need to know, is that there is hope to get them well.
Absolutely.
It is always fun to have those patients, even though we want not every patient to be, last resort. It is fun to have patients that have seen lots of different types of physicians, and now you're the last resort, and you know you can help them. It's really
And we
a
do.
nice feeling to get those type of patients and be able to kind of turn things around for them.
Do we have that? You have a video clip you wanted to show? No
We'll
video?
show it on the next episode.
Okay.
When we have her back again. So, other testimonial. We just have a minute or two left in the show. Do you have maybe a testimonial?
Well, let's talk about that. Since you talk about last resort, I had this one young lady. She was in her early 30s, and she had went to neurologist. She went to a GI doctor. She went everywhere, and she was having really bad headaches. When she would eat, it would zonk her out. Her husband had to taking care of the children along with his job. I mean, she was just almost non-functioning for about 1.5 years. So they scoped her from above. They did a colonoscopy from below. All these tests. They did H. pylori tests. They did, everything, and everything was just coming back normal. So. Even to her own parents were, I know her parents really well, and they called me, we just want our daughter back. So we started with the micronutrient testing, and she was severely vitamin B12 deficient. And so we did some hormonal testing as well, and we did neurotransmitters, which will segue us into...
We'll talk about that
next time. So when we got everything balanced out, she was able to see a tremendous change and difference in a short amount of time.
That's awesome.
So
awesome.
yeah, and that was after seeing several specialists. And one of the things about vitamin B12 deficiency people don't understand and know that it also can cause what we call low acid in the stomach. So every time she did eat, it would zonk her out because she didn't have enough acid. So when she was just eating crackers and things that she could tolerate to ease the nausea, so then she would become further depleted in nutrients.
Making no nutrients from crackers.
Because she couldn't do vegetables, because you need to have a high acid content
To digest them.
to digest the vegetables. So it was almost like a vicious cycle. So that was one of my
That's
like
fantastic.
rah-rah, yay.
That's awesome.
I'm glad we was able to help
And
her.
thank you for joining us. That's all the time we have today. This has been Ask the Chiropractor. I'm your host, Dr. Adam Rodnick, out of Commerce Township, Michigan.
And I'm your co-host, Dr. Ruvayn Rubinstein out of Troy, Michigan.
And we are here with our special guest, Dr. Grace Patterson. We'll see you next time. Stay healthy.